All right. Welcome everyone to another series. I am going to be talking about the Brahms biomarker. Today it's going to be all about procalcitonin. So let's get started with procalcitonin, right? So procalcitonin is a blood test that is ordered on patients that are presenting signs and symptoms of being septic and or they have some kind of bacterial infection within their body. So normally, whenever a procalcitonin is ordered, it's ordered along with a battery of other tests. So blood cultures, maybe a CRP, a CBC, complete metabolic panel, blood cultures ×2. And depending upon what's going on, and I'll go ahead and say like a pro-BNP because it's going to tie in with the clinical trial test or clinical trial that I will be talking about. It'll tie in with that. And so with that being said, so if your results for a procalcitonin blood result is positive, obviously the doctor is going to say, hey, let's give this patient an antibiotic. However, the antibiotic is given based upon the organism that is wreaking havoc within the body. So remember the blood cultures I talked about that's ordered along with the procalcitonin result? Well, those blood cultures are going to differentiate between what kind of organism is wreaking havoc within the body. So say, for instance, you have a positive procalcitonin result and a positive blood culture result, and it's not like a skin contaminant or anything like that. Let's say the positive blood culture comes back with you being positive for Staphylococcus aureus, or they call it Staph aureus. Usually the antibiotic of choice is vancomycin. Vancomycin is a very powerful antibiotic, and it will normally work for patients that have bacteria that is susceptible to the antibiotic, which means they're easy to kill off. Now, if it does not work, if the vancomycin does not work for that particular patient, that means that the bacteria that is wreaking havoc within your bloodstream can no longer be killed off by the antibiotic, which means it's resistant to that particular antibiotic. So that's how they use procalcitonin as a biomarker to say, hey, we need to, give this patient some kind of antibiotic treatment, but it's based upon the organism that's wreaking havoc within that patient's body. Now, since we kind of covered what the purpose of a procalcitonin, the blood test, what it means and why it's ordered, and let me back up. Patients that spike a fever, normally it's because either they have a viral infection or a bacterial infection. And in this case, whenever a procalcitonin result or a procalcitonin blood test is ordered, that means it's a bacterial infection. That means an antibiotic treatment will be necessary to help cure the patient, if you will. So now what we're going to do is we are going to talk about the clinical trial that was conducted in Europe that used the Biomarker-Procalcitonin blood test as one of their blood tests for patients that have acute heart failure, right? So as we're looking at this particular clinical trial, I think it was conducted in 2019, in Europe, 18 sites. I just want to go ahead and kind of maybe help break this down for you. So basically they wanted to see if the antibiotic treatment or therapy with the procalcitonin result within 8 hours of admission into the ER, is it going to help the patient that has acute heart failure? So they had two cohorts, two patient groups. Both groups had acute heart failure. However, group 1 had a negative procalcitonin result, which means really no antibiotic treatment is necessary. Group 2 had a positive procalcitonin result, which means they had some kind of bacterial infection, or either they were septic and an antibiotic intervention was necessary. All right, let's move on. So basically that's what that means. And I think according to this article, I think they had close to 600 patients that were within like the 18 sites that participated in this particular clinical trial. Now with this introduction, it just goes into what acute heart failure means. And now with the biomarker procalcitonin, obviously it's used to indicate whether you have a bacterial infection or not. But since these patients have acute heart failure, a blood test called C-reactive protein is normally ordered on patients like that because it says, hey, you are at risk for a high cardio, if it's high, you're at risk for cardiovascular diseases. So with that being said, they kind of swapped out. Well, it looks like they swapped out the procalcitonin for the C-reactive protein. And again, procalcitonin results are elevated in patients that have a bacterial infection. And some of the bacterial infections that talked about here is pneumonia and urogenital infections, which is very typical of acute heart failure. So what they found was in this particular study, well, of course, the patients that had a negative procalcitonin result, which means they did not have any bacteria infiltrating their body or their blood, it didn't help. So if you don't have a bacterial infection, then antibiotics is just not going to work. However, the patient group that actually had a positive procalcitonin result, antibiotic interventions was necessary. And it eventually goes on to talk about what kind of antibiotic was used for this particular group. I'll get into that a little bit, but I just kind of wanted to share like how important it is for you to participate in clinical trials, because clinical trials will help determine whether or not certain blood tests will be of use or be of helpful to help treat you as the patient. So I will be coming back with another small series. This is very short and sweet and to the point. I want to make sure that whenever I deliver this message that it is as simple. I break it down as simple as possible. And we're going to, again, go through an actual clinical trial that was conducted that used this particular biomarker, again, the procalcitonin. And I'm very familiar with procalcitonin because that was one of the biomarkers that was ordered in the hospital that I worked for, a couple of hospitals that I worked for, whenever patients spiked a fever. They're like, hey, let's go ahead and order this procalcitonin result or a blood test along with a battery of tests. So again, if you look down here, ProBNP, that's basically what that is, was actually ordered on these particular patients. And ProBNP is a blood test that says, hey, this patient has congestive heart failure. Now, a lot of times whenever patients are having heart issues presented into the hospital, other tests such as the cardiac enzymes, they're ordered, and again, along with the proBNP. Now, cardiac enzymes, which is the CKMB, and troponin. The troponin is very specific to that heart muscle. So if it's elevated in any kind of way, critical, then obviously this patient is having a heart attack. Let's see here. What else can we go over? I think we'll just stop right here. And again, keep it simple just for this particular introduction. The next time we're going to get into the methods, the study design, and the randomization and group assignment within this particular article. Sometimes we just need to help break down what these articles mean, what these clinical trials mean, and how important it is that we have patients participate, because again, you matter, and depending upon the results, depending upon how things go, there'll be physicians and doctors will be able to order like the battery of tests specific for patients that have acute heart failure to help treat the patient and hopefully, get them into a better place, healthy place within their bodies. This is all I have for today. Hopefully you learned something. Please let me know if you have any questions, and I will be happy to answer them. But we're going to continue on with this series. And again, just breaking down this particular article. And I just really want to make sure that people understand like why clinical trials exist in the first place. So, and you know, again, you matter. So with that being said, this is the end of the video. I appreciate everybody listening, and I will come back shortly with another great video. All right. Yes.